Wow.
Hello viewer, we welcome to my YouTube channel which we call knows.com. Well, today we are going to talk about the most commonly nursing diagnose that we can use when we are trying to do patient care in any health facility. In the previous time we talked about nursing process, and now today we are going to talk about the diagnose, because after assessment, what are you going to do? We talked about the 5 pillars of nursing process. So today let us try to know the most commonly nursing diagnose that we can use and realize that the problem we are going to get it from NANDA. The problem from NANDA. NANDA being Northern American Nursing Diagnosis Association. And most of the disease condition you can see, there are certain conditions, signs and symptoms of clinical manifestation related to it. So what are the diagnoses that you are supposed to give to that particular patient? For instance, we are going to talk about the respiratory distress. For instance, respiratory distress. Under respiratory distress, we have what we call as central cyanosis. We have what we call also as fast breathing tachypnea. We have what we call orthopnea. Orthopnea means shortness of breath, and also tachypnea means fast breathing. And this one is shortness of breath. Coughing. These are all part of coughing. So, for instance, when giving nursing diagnosis, you are going to look at the clinical manifestation, or you look at problem that may arise in future. But in this case, let me just list the most commonly nursing diagnosis we can use when there is problem. One is what? Is ineffective airway clearance. Ineffective airway clearance. Ineffective airway clearance is a situation when the airway becomes obstructed during the caregiving. So what are you going to do? If the patient has what we call ineffective airway clearance, the airway is not clear. So the nursing diagnosis that we can use for that particular patient is ineffective airway clearance, right? We have also what we call as impaired gaseous exchange. Impaired gaseous exchange. This is another nursing diagnosis that we can use. So impaired gaseous exchange is when the oxygen demand of exhalation and exhalation is not in correct order. So that is what we call impaired gaseous exchange. It can occur either due to high carbon dioxide in the body, that is hypercapnia, or due to another suffocation. We have what we call as fluid volume deficit. Fluid volume deficit, we can give this diagnosis when someone is losing fluid. For instance, someone is vomiting, someone is bleeding. This is the diagnosis that we can use for that particular patient if you see that the patient is having that problem. We have another which we call risk for fluid volume deficit. Risk for fluid volume deficit. Risk of fluid volume deficit is another diagnosis that we can use for patients that is at high risk of losing fluid. and there must be a signs and symptoms representing this. Alright, we have what we call ineffective breathing pattern, ineffective breathing pattern. Ineffective breathing pattern is another diagnosis we can use for patients in respiratory distress. Are you getting the joke? So these are the diagnoses that we can use. We have what we call as acute pain, acute or chronic pain. When patient is in severe pain associated with nervous problem, this is the diagnosis that you can use. We have what we call imbalanced nutrition less than body requirements. Imbalanced nutrition less than body requirements. So if we see this, somebody who is losing weight or somebody who is not eating or having what you call anorexia and loss of appetite, and you are seeing the person is losing weight, so this is the diagnosis that we can use: imbalanced nutrition less than body requirement. Whenever somebody is losing weight or the person is not allowing to eat due to certain condition. We have another one we call as hyperthermia. Hyperthermia, it is a diagnosis we can give from NANDA because a patient is having fever. When there is fever problem, hypothermia. When patient is having what we call cold extremity, or the temperature of the patient is too cold, subnormal temperature, we can give the nursing diagnosis we call as hypothermia. This is another nursing diagnosis that we can give to that particular patient. A patient is unable to walk or do activities, we can call it as activities intolerance. Activities intolerance is another diagnosis that we can give patient who cannot do work on his or her own, or who cannot walk. Activity can either be walking, grooming, bathing. We have what we call as impaired verbal communication. Impaired verbal communication is another diagnosis that we can use for patient who cannot talk well, or patient is unable to talk, or even when patient is talking but there are certain difficulties, the talk is not well oriented. So we can use this word impaired verbal communication from NANDA. Now we go to what we call as self-care deficit. Self-care deficit is the diagnosis we can use if a patient cannot take baths on his or her own, or cannot take care of his or her body, personal hygiene. We can call this as self-care deficit. When patient is in a hurry, we call another diagnosis as anxiety. It is a diagnosis that we can give to patient when the patient is uncomfortable or worried, either due to his or her health status, either the patient is, let us assume that the patient is trying to say that to die, or because of hospital bill, or because of family rule. This is the diagnosis that we can give to that particular patient, which we call anxiety. We have what we call ineffective tissue perfusion. Ineffective tissue perfusion. The ineffective tissue perfusion is another diagnosis that you can give patient if there is not enough oxygen flowing to the extremity or to the body due to either metabolic disorder. So we can use this diagnosis from NANDA. So these are the most commonly diagnosed that we can use from NANDA in order to develop care plan for the patient. There are so many diagnoses, but these are some of the diagnoses that we can use. So please subscribe to my YouTube, like, share, ask questions, through comment so that we can do another thing. But these are the most commonly nursing diagnoses that we can use.